Welcome to our web podcast, Powering Public Health: How Digital Innovation is Transforming Health Systems. It is presented as part of the dissemination of the project Qadam. This session brings together valuable perspectives on the role of digital innovation in advancing public health and health system strengthening. I'm pleased to welcome our distinguished panelists. Today we have with us Dr. Zeeb Dahar, Dr. Qudsiya Uzma, Ms. Farwa Hasnain, and Mr. Usman Anwar. I would like to start off with Dr. Zeeb Dahar. Under the project, FP Counseling app has been developed. So, would you like to share how it will enhance the quality of FP services for the women?
Thank you, Ali. So, one of the component in Qadam project was to, provide a framework for quality assurance. So, हम काफ़ी अरसे से quality की बात तो करते आ रहे हैं, and we have quality assurance framework available. We had a notification through this project from provincial government how to implement quality a piece of work, but somehow implementation remained challenged. So we really wanted to work in a way how to improve the quality of services. So one of the need which identified jointly with World Bank colleagues, because they are supporting a big project in Punjab Family Planning Project, and also in Sindh. So they really wanted us to support governments to develop a standardized kind of counseling application in which providers should have a same uniform counseling to all family planning clients. So we developed this application, which is a comprehensive application, and we developed jointly with technical support from WHO, and RAIN has developed this for Sindh and Punjab. This is one of the SBC intervention in which we have focused mostly on healthcare provider, because uniform standardized counseling remained challenge.
Thank you, Dr. Zeeb. And as Dr. Zeeb mentioned, the digital adaptation kit by the World Health Organization, Dr. Qudsiya, can you please share more about the digital adaptation kit for family planning that WHO has developed?
Okay, thank you. So, by mandate, the World Health Organization produces science based guidelines with rigorously tested recommendations for health interventions that need to be adopted within country programs for its implementation. And when applied correctly and consistently, such technical guidelines and their recommendations are basically intended to save lives and protect lives. So, in order to support the countries to incorporate the WHO science based guidelines into their systems, and as part of the SMART Guideline Initiative, WHO has developed these digital adaptation kits, as the one that you have mentioned about family planning. So, there is also a family planning digital adaptation kit, but there are other similar adaptation kits, digital adaptation kits for other technical areas that are also produced by WHO.
Thank you, Dr. Qudsiya. Dr. Qudsiya, in WHO's experience, what were the key challenges when it came to implementing these across the provinces, and how do you think these barriers would affect when it comes to adopting the apps or scaling up these apps?
As we know, Pakistan is a diverse country, and we have 4 provinces, 3 regions, and all of them have very diverse needs, very diverse and variable infrastructure and capacities. In any country, and not only in Pakistan, including Pakistan, and for any digital intervention to be sustainable and scalable, it has to be adapted and fully integrated into the existing routine health information system and the existing available digital platforms. However, sometimes the challenges of internet connectivity, electricity availability, and even the softwares and hardwares availability can limit the scalability of digital interventions, more so in remote and rural settings. But we all know that when we are adopting new tools, we will always have challenges. But if we can work together and we can sort of have it as a joint effort, we can always overcome the challenges, and there are always opportunities that can be seized. So the good news that I would like to share is that the Ministry of National Health Services Regulations and Coordination, Government of Pakistan, has already developed and that has already been approved a very important national strategic document, which is the National Strategic Framework on Digital Health. And this is basically a framework that is there to guide the introduction and use of digital health interventions at both the national and subnational levels. And in the same connection, Pakistan has already made good progress in digitalizing health information systems across multiple levels.
Thank you, Dr. Kustia. Farwa Saiba, I would like to ask you, in your experience, what other digital innovations can be used to enhance service quality of FP services?
In terms of what else can be done, we feel that, first is closing the data loop through longitudinal ECR integration, which Dr. Zaib has also mentioned at the start. We all know that health data in Pakistan is quite fragmented. A woman's family planning record, her maternal history, her nutrition data, all of this sits in silos. Every interaction with the healthcare provider treats her as a new patient. So I feel that it's very important that it's all integrated and unified. So I think first thing is its integration into the ECR and the EMRs. Second, I feel is the targeted client communication. I feel that is also something that's being done, but those kind of digital interventions are also very, very powerful, because when there are follow-up messages after the counseling is done, it does increase contraceptive uptake and the method continuation, as we've seen in many parts of the world. Third, I feel that, I think telemedicine can also be a clinical bridge for complex cases, post-abortion complications, unclear method eligibility. A real-time link to a specialist transforms what a rural frontline provider can offer. Telemedicine, when it's embedded into a structured referral pathway, becomes a force multiplier for the LHW, who would otherwise have to refer the client away entirely. All of this we could not think about doing some decades ago, but I think now technology allows us. Another one that I can think of is digital supply chain management, because when a woman summons the courage, often against significant social pressures, to seek family planning services, as we all know in our country, and arrives to find a stock out. This is not just a logistics failure, it is a trust failure she may never recover from. So I think C4H service provision data can and should feed directly later on into district level stock forecasting. Globally, I think last mile supply chain visibility has been one of the most impactful digital interventions in family planning programs.
Thank you, Farwa Saiba, for the detailed answer. I have one more question from the health tech innovation perspective. What were the key principles that were considered to ensure that the app is clinically sound and user friendly for the frontline healthcare providers?
I personally and the rest of my team feels very strongly that the most impactful solutions are the ones which are built at the ground level with the input of the people who are going to later on use it. So I think first principle was that we were designing for, keeping our cultural sort of aspects in mind, and especially when, talk about rural Sindh where this is going to be used. So I think C4H was designed to make that conversation very safe. And the structured workflow means that the provider isn't raising these questions ad hoc from memory. And I think this has been mentioned by some of the other panelists at the start. So this is standardizing the questions that they're asking. And then I think second was the workflow design, and it was very deliberate in terms of gendered. It is something that reflects how family planning conversations actually unfold in Pakistan.
Thank you, Farwa Saiba. It was very informative. Since it will be used across board, there is no rural-urban divide. So it brings me to Usman Anwar Sahab. Um, how do you think that voice-based and low-tech solutions like IVR and SMS can complement such apps, and especially when it comes to reaching out to the underserved populations?
Thank you. I think at Viamo, we believe that mobile phones should be a lifeline and not a barrier. And as a global social enterprise, we work with so many of our partners to bridge the digital divide. And what we've seen is that we have the opportunity of using existing devices that caregivers or beneficiaries have, and turn those devices in their pockets into tools for life-changing information. Um, so while we do build technology, we work with our partners to ensure that it reaches the last mile, those populations that are typically those which typically digital tools tend to leave behind.
So when it comes to private sector and digital innovations, how is the private sector ensuring its alignment with the national health priorities in order to avoid, any parallel platforms or reinventing the wheel?
There are two parts to it. One is that we can deploy technology on platforms that exist right now. For example, we look at government owned and operated hotlines. You can introduce an innovation then and there on that uh, well sensitized and popular short codes or long codes that are accessible to beneficiaries and mass. That can be a little scary because essentially what you're doing is you're making a live deployment on a platform that exists. So quite often we recommend a pilot scale up approach without really catching ourselves in what we like to call pilotosis, essentially, that we don't want to be working in too many silos or doing too many pilots without being completely aware of how the public health system is performing. So I can give you an example of the cervical cancer Gen AI hotline that we developed. We developed that in partnership with the Federal Directorate of Immunization. Essentially, we made sure that when a beneficiary calls on a particular short code, which was meant to test and pilot Gen AI, it would use the exact same content which is approved by the Ministry of Health and the WHO. So when you're getting that advice from, let's say, an automated system, it should not hallucinate. It should not give you things which are not grounded um, in our cultural context and in the effective and actionable medical advice which our government health partners and the WHO creates. And in situations where the automated system was not able to answer a query effectively, or if it sounded like a very complex triage question, the Gen AI would quite simply transfer the call to 1166, which is the National Health or Sehat Tahaffuz hotline. So we co-created this. So while we are testing outside the system in a way, we are designing for the system.
Thank you for a detailed answer, and thank you so much everyone for taking the time out and for sharing your valuable inputs. I'm sure those who are watching us learned a lot. We will see you next time.